And hello, everyone, and welcome back to Cyrus Webb Presents. Excited about today's program. We have a full hour with a trusted panel of doctors today to discuss something that's very important. We have some new faces that are joining us today, so I want to welcome all of you that are tuning in, both for our audience on Instagram. I see you guys over there. I'll be looking for your comments. I see you all already coming in. Hello to you, Jacqueline. Also, we have Facebook, we have Instagram, we have YouTube. We're about to tune in, though, with our Amazon Live family, which is our primary platform that we are broadcasting this on. We have an amazing panel of doctors. I'm about to introduce them. But today we're going to be talking about something that's very important, and that is your health. I think as one of the things we've all learned through the pandemic is the importance of being able to take care of ourselves. 3D Apparel, hello to you. So we're going to definitely talk to these doctors about what it's been like for them to be able to help their patients, but also about a supplement you all may not have heard about. It's called Panoxol. We'll be getting into that a bit, as well as letting you know who it's for, what it does. And of course, I want to hear your questions as well. So if you guys have any questions, all of you are on platforms that you can be able to type those in. I'll be bringing those in. Doctors, thank you so much for the time. We're going to go ahead and connect with our Amazon Live family and get started. And you all are watching Cyrus Webb Presents here on Amazon Live. We're also joined by our friends on Instagram, Facebook, LinkedIn, as well as on YouTube. I'm Cyrus Webb. We have a great panel of doctors joining us today. For those who are joining us on some of the platforms, you all saw them with me actually last week. We're excited to welcome back Dr. Ronnie, Dr. Matthew Michaels, and Dr. Roxanne Smith. I actually met all of them because of a good friend of mine. That is Mr. Willis Victory. He's a global business leader, as well as the founder of Plant-Based Sciences International. Today, we're going to be talking about a supplement that has been getting a lot of attention that we definitely want you all to know about, and that is Panoxol. Now, I just found out about Panoxol myself this year. We're going to talk to the doctors, not only about what it's been like for them to share it with their patients, but also who this is for and why it's something you need to know about as we're going through life and trying to be able to take care of ourselves along the way. Doctors, thank you so much again for the time. Really appreciate it.
Absolutely. You're welcome. Great to be here.
I'm going to start off with you, Dr. Smith. Let our audience know a little bit about your background and what it's been like for you to be able to do the work that you do.
Okay, thank you so much, Cyrus. I'm Dr. Roxanne Smith White. I am board-certified internal medicine physician with over 20 years of experience. I have taught in medical schools. I have outpatient and inpatient medical experience. And I've also done administrative experience in different jobs that I've held. I recently moved to Hawaii because I needed to live within my principles. And one of those principles was a vegan lifestyle, being closer to the land and being able to eat a plant-based and lead a plant-based life. I was lucky enough to early in my course be introduced to plant-based sciences through Clinical and Herbal's Keith Matthew. That was a very, very, very lucky introduction. And because of that, I was able to meet these wonderful group of people recently who have been doing wonderful work with plant-based medicine. And our first product coming out will be Panoxol. Panoxol is food-based, but it's essential foods that we need. And I will defer to Dr. Michaels, who is our content expert, to go into great detail. Another thing I'm excited about with plant-based sciences is the research lab, the conference facilities that we have coming, the healing retreats that we'll be doing with Dr. Ronnie, she'll explore, and the soil to consumer control when it comes to how we put the products out. We will be making sure we know what's in the soil. The plants that we're growing will be organically grown. Things will be a vegan base, and it will be a great help. Now, I personally have been taking Panoxol myself just to see the effect. I have hypertension according to some of my doctors, but I have been taking Panoxol primarily because of the effect that it has on blood pressure and making sure that I can lower any kind of medication that I'm on. And right now I'm on none besides Panoxol. So with that being said, I'd like to pass it over to Cyrus so that we can move on with introductions.
Thank you so much, Dr. Smith. Glad to have you back with us. Dr. Ronnie, I'm going to go with you next. You're the first doctor of the group that I was introduced to through Willis Victory. Talk to us about your background and what it's been like for you in working with Panoxol. Then we'll go to Dr. Michaels.
So I'm very excited to talk about this as always. I come from a background of allopathic nursing. I ran several nursing homes throughout my life, and I worked in some of the most prestigious hospitals in the country, including Yale New Haven Hospital. And then I got sick and I went over to alternative medicine. I went back to school. I became a naturopath and a homeopath and a medical nutrition. And I wrote a New York Times bestseller book on detoxification. So with that being said, when Willis and I started talking about, many products, I got really excited about Panoxol. The first thing I want to talk about is who is it for? Okay. I started taking Panoxol after I started giving it to some of my clients because I was thinking, I do all these healthy things. I don't really need to take it right now. But then I got sort of jealous, right? Because I got all these people started telling me all these things, what was happening to them. I had one client say, she was my nurse, and she says, oh my God, I went for a walk for hours today. I went for a walk for like 5 miles. I says, you walk 5 miles? You never walk 5 miles. And then my sister started saying she was running with the dog. The dog was like looking at her like, why are you running me like this? And so I started thinking I was missing out, right? So some of my clients, these are my clients. I have a 15-year-old that I get very passionate about. I know for a fact that the Panoxol helped him because even though he was losing weight slowly until I gave him the Panoxol. And his mother and father kept saying, he's 15 years old. I'm passionate about him. She kept saying, he never wants to exercise. Forget it. He's never going to exercise. Never, 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 never. And he started walking. Then he started walking fast and he started dropping the weight. And I know it was the Panoxol. Who else is this good for? People that have poor circulation. You hear them talk about it. They don't want to do anything. They just want to sit at their desk. Who else is it good for? People with blood pressure issues. If you could think of anything that causes good blood flow, that's Panoxol. So there's all types of chronic illnesses that has blood flow problems. I mean, and inflammation problems. It's not just weight loss, it's energy, it's everything. And so that's why I'm so excited about it, because I have to say, guys, who is this not for? Okay. And so when you say who's it for, I'm trying to think, who is it not for? So, of course I got on it. So then I started slow because I'm one of those careful naturopaths, right? So I started taking 2. Then someone said, no, I'm up to 4. And then I got jealous again. Now I'm up to 4. And I'm telling you, I feel great. I think my brain's working better. I really do think that. So I'm excited about Panoxol because I experienced it myself. A lot of my clients are experiencing it, and I'm getting nothing but great testimonials about it. And that's why I'm excited. And I'm writing a book about it. I'm introducing it to people that come to the retreat, so they see my excitement about it only because it works. It brings oxygen to your bloodstream, guys. So there you go. I can go on and on and on. I don't want to take up the whole thing.
I want to mention, Dr. Ronnie, since you mentioned the book that I'm going to highlight for a moment there on the Amazon Live side of our platform. So if you guys are joining us on Instagram, Facebook, YouTube, as well as on LinkedIn, you'll notice there's a link there to take you over to Amazon where you all can be able to watch this also and actually see all of the doctors. Everyone can see you guys right now except for our friends on Instagram, because of the way the platform's situated, they can only see me right now. But we put the link there. Make sure you guys do click there. Dr. Ronnie's also the author of the book, 21 Pounds in 21 Days. Since you mentioned the book, I want to make sure we highlighted that. Our next guest also has written an important book, Take Control of Your Back Pain. We're excited to welcome Dr. Matthew Michaels to our program. Dr. Michaels, welcome back. So I want to ask you now to let our audience know, for those who may have missed your previous conversation with us, let them know about your background, but also what it's been like for you to share the benefits of Panoxol.
Absolutely. So I think that for me, the key to understanding me is that I am a ridiculous nerd about this kind of thing. I am a big believer in knowledge. And for me, I want my patients to understand what they can do for themselves. In terms of medicine, I'm not really fond of passivity. I don't really like the idea of take a pill, to do this or take a pill to do that. That's kind of falls into this model of when you're treating a disease once the horse is out of the barn, where you're just kind of waiting till you actually get sick, and then you're taking a pharmaceutical powerful product to try to treat the signs and symptoms of that disease rather than getting at the underlying condition. A lot of that is informed by my history. So I've had back pain my entire life. Since I was 12 years old, I was running the 50-yard sprints, if that gives you any idea, 50 yards, how old I am. And came up out of the blocks at the age of 12 and hit the floor immediately. I had apparently ruptured a disc. And of course, there was no MRI at that time, but I know from the consequences of that that's what happened. So, at the age of 12, that's just a genetically weak disc. That has led to a lifetime of pain. I have never really had a day in my adult life that I was not in pain with my back. And so over the course of years of trying to deal with that as a child, and in that informing my decision to become a doctor in the first place, and then going into a primary musculoskeletal field being physical medicine and rehabilitation, I finished my training in that in 1996 and went into interventional pain management, and really kind of found that the interventional process of injecting steroids and doing nerve blocks and nerve ablation procedures, they can be very potent, but their results never last. They don't really treat the underlying problem, because the underlying problem is a biomechanical problem. And the only way you can really treat that is understanding it. And so that began to inform my philosophy of education. I like to teach my patients how to help themselves. My primary philosophy is the more I teach you to help yourself, the less you really need me. I don't really think I need my patients coming back to see me more often. I think if I get you better, there are plenty more patients behind you that need my help. So it's all about education. And that led to another episode for me, which was a very bizarre illness that developed in 1999 and caused a great deal of distress in my family. We thought I was going to die. It was diagnosed as a brain cancer, a glioblastoma, the most malignant form. I was told I'd be dead in 6 months in April of 1999. That clearly didn't happen. But my doctors didn't really have a good grip on what was going on. They didn't understand the disease. They thought I had cancer. Then I thought I had an infection, and it was a mess. And it went on for years with my having multiple seizures a day. And finally, I had to diagnose myself. I had to go to the hospital, pull my records, pull my pathology slides, and actually look at them myself and make a decision that this isn't a cancer. There were no tumor cells available at all. It was just an inflammation of my brain and of my blood vessels in my brain. So I ultimately ended up devising my own treatment plan, and I went to Duke. My slides went to Sims Murphy and down to MD Anderson and in Houston, the CDC, the NIH, everywhere you can think of, and they could not diagnose this problem. Ultimately, it fell into the category of an autoimmune disease, and that was treated with chemotherapy and a bone marrow transplant, which was designed again by myself. So again, understanding your disease. I think that the most important thing you can do is educate yourself, or find a doctor who believes in education so they can teach you what's going on in your body. And then you can take it from there, because nobody's going to be a better advocate for you and your health than you. So over time, that further informed this drive for me to educate and teach people about their own disease. So ultimately, I developed a plan to treat my own back pain. And after the transplant in 2002, I went on to do Ironman Triathlon in 2012 because of this understanding of what the back problem really was and why it kept on hurting. It wasn't because the injury that I had when I was 12 kept on hurting. It's because I kept on doing things with my behavior that fit into the problem, that re-injured my back over and over and over again every day. Until I understood that, I didn't get better. But once I did understand that my posture and my movement patterns would really change my life, I was able to do Ironman, and I was able to do 10 or 20 half Ironmans and more Olympic distance and sprints than I can count, with a back that quote unquote needs surgery. I've been offered a fusion of L5S1 more than once, but I simply won't go down that path because I feel there's going to be too many potential for complications. So again, getting back to Panoxol really falls into that same category, because Panoxol is about the ingredients, and understanding what each one of these ingredients can do for you and your health helps you really understand why you want to take this every day, what it will actually do for your vasculature, for the lining of your blood vessels, to actually help prevent the leaky blood vessels that lead to leg swelling and discoloration of your legs and what's called chronic venous stasis. That can help improve the blood flow to your brain. But again, this is about knowledge and understanding that just taking the pill is not what you really want to do. You want to understand that you're doing this for health reasons, and that you want to then take advantage of all the other things you can do for your own health, like exercise and eat properly and follow a plant-based diet as much as possible. I think that it's not okay to kind of have somebody tell you have to be a vegan or you're a failure. Just simply doing your best to eat less meat, get more of your nutrition from plants is where most people really need to be. it's going to be a sliding scale. But again, don't feel guilty if you can't skip that one hamburger a month. Just do your best to follow that plant-based diet and exercise as much as you possibly can, because these are the things that are really going to move the needle over time. And Panoxol should be a part of that plan. And once you understand what each of these ingredients can do, you'll have a much better idea of where this process can lead you.
Of that. We're going to get more into that, and we have some questions that are coming in for our panel, so definitely you all stay tuned for that. I want to say for those who are just tuning in, you're watching Cyrus Webb Presents on a lot of different places. Our primary place is Amazon Live. While you heard Dr. Michaels talking there, we were highlighting his book, but now we're actually highlighting Panoxol Plus that is actually sold on Amazon, so you all can click there to be able to find out more information. Appreciate Mike, appreciate you joining us on the Amazon Live side with your question. We're about to get that answered for you. But I want to say, too, as a little housekeeping tip, if you guys are not joining us on the Amazon Live platform directly, there is a link that is wherever you are on Facebook, on YouTube, as well as LinkedIn and on Instagram. Feel free to be able to click that link. That'll take you directly over to Amazon. If you hover over on this side, you'll notice a follow button. You can give us a follow there for more great conversations like this on Amazon Live. If you're on your desktop or laptop, if you're on your mobile device, you'll notice the follow button below. For those joining us on the desktop or laptop, you also will notice the products that I'm discussing actually beneath us. So as you're watching the video, you'll notice the book by Dr. Ronnie, the book by Dr. Michaels. You also will see Panoxol Plus. It's highlighted now. You can click on that and literally find out more information about it and purchase yours without even leaving us here. I want to get to Mike's question on Amazon Live. And again, if you all have any questions on Facebook, LinkedIn, YouTube, or Instagram, make sure you guys post those. But Mike wants to know, I have ankle pain. Will Panoxol work for me? Who would like to take that for Mike?
Well, anybody can take that question. Actually, I just saw a patient virtually through a telemedicine platform that asked the same question. The patient had ankle pain, but it wasn't from an ankle injury. It wasn't from a tendinopathy. They had swollen ankles and a history of mild heart problems that looked to me like they were getting worse, and they were developing ankle swelling as a result of that, which can be very painful. If that's the problem, then Panoxol definitely can help potentially with that. But it's important to understand that we're not going to claim anything about Panoxol. This is a patented combination of herbal remedies and amino acids that is not meant to diagnose, cure, prevent, or treat any disease. We can talk about the ingredients and what they might do. So, for example, horse chestnut has been known to reduce ankle swelling and pain that comes from vascular problems. If, in fact, that's what's going on, yes, it can help. If it's an ankle sprain or a strain or an arthritis problem, it may help, but there are other things that could help more than Panoxol.
Right.
Dr. Ronnie, Dr. Smith, anything you want to add to that?
Yeah, thank you, Dr. Michaels. He's absolutely right. One of the things you got to understand is that when you have pain, most of the time that pain is stemming from inflammation. And with inflammation, you have to understand that not only does that happen, but now you're going to get some water around it, edema, we call it. So on top of both of those things, you have ankle swelling. You know, this product is excellent for decreasing inflammation and decreased swelling and increasing circulation. So with that being said, anything else that you're taking for the pain, it's only going to enhance it and help it.
Love that. Love that. Dr. Ronnie, since we have you there, you mentioned something earlier I wanted to go back to. And we have another question that just came in that was directed toward you, Dr. Ronnie, and we're going to get into that too. But you mentioned earlier something I wanted to ask you about. And you mentioned about, it seems that you were talking about stamina. Can you kind of talk to us about Panoxol and the correlation with increased stamina? Because you mentioned, of course, I think one of your patients talking about running and with the dog, walking with the dog. Talk to us about that and the correlation there, if you don't mind.
Absolutely. One of the things that happens at the retreat, and the reason why people come to the retreat, is they're sort of beat up. We call them, the broken shell, beat up. They have low energy. They have fatigue, which to the point where they can't think clearly. So we're talking about not only in the brain, but we're talking about whole body fatigue. And the reason that happens is not just poor nutrition, but it's also what their lifestyle is about. Their lifestyle is really about not moving. And sometimes when you don't feel good, you just don't move, right? So that's the number one thing that you can count on with Panoxol. It's going to increase circulation, increase blood flow, increase the nutrients to the cellular level. So we're doing that all day long at the retreat. So that's why by the time they go home, not only do they lose 21 pounds, but they look better, their skin looks better, their energy's better, they're able to sleep at night, all because we're saying that it's nothing more important than blood flow.
Love that. Dr. Runner, the question that came in for you, and it's up to you how you choose to answer this. If you want to give out more information, how they can find out the answer. But eShopper on the Amazon Live side asked, Dr. Runny, what would be my cost approximately for the 21-day detox? Like I said, it's up to you if you want to go into that here or somewhere where they can go for more information about it.
I can tell you one thing. You will never, ever forget the experience for the rest of your life. The cost, that's not for me to answer that. I have staff, from A to Z. They tell me all the time, stay out of our business. You treat, you heal them, but business is not your thing. Money is not your thing. You mess up all the time. So I can't answer that because I truly, honestly don't know. It's from 1 week to the next is always different. But try to get in touch with my company and we'll give you all the information that you need. I hope that helps.
All right. And Dr. Runny will be giving out her information at the end too for you to stay connected. Dr. Smith, I want to come in because we do have a question for you as well. You talked about making the changes you made when it came to a plant-based lifestyle. Talk to us about what you normally tell your patients about the benefits of that. Dr. Smith, we lost your sound.
Got to unmute.
Oh, I'm sorry. I muted to make sure I wouldn't make any funny sounds.
Okay, all right. Okay. Yeah.
Okay, yeah. As I was saying, the benefits are tremendous. I have my personal story with going vegan is that I started this journey around 2012, 2013. And I have been trying to fully release all animal products for all of that time. When COVID-19 hit, and I realized that this is a metabolic disease, something that affects you at the metabolic level. It affects your blood vessels. Now we've figured this out. But even before, we knew that nutrition was optimal when we found out that vitamin D was necessary, zinc was necessary for people who didn't do as poorly. I went vegan overnight to make sure that I could be there for my inpatients. I currently work in an inpatient situation, taking care of COVID-19 patients, and I wanted to optimize my health. I lost 30 pounds in the time frame it took for me from going from fish and chicken and primarily vegetables to full vegan. And then luckily, like I said, I've met with these groups from Panoxol, and I have been taking the Panoxol, working in the hospital at my age, working directly with the patients. And I'm running around as if I'm one of the interns I used to teach when I was in a teaching institution. And so the layering on, as Dr. Michaels has said, a healthy diet, movement, taking the Panoxol to assist in making sure that your blood flow stays optimal. You're getting the food that you're eating to the cellular level, as Dr. Ronnie said. These are the reasons why we all have come here to talk to you about the benefits of Panoxol and the fact that once you layer it into a healthy lifestyle, it can maximize your health. Now, back to the vegan story. I like I just told you, veganism is not an easy thing to jump into. So I don't think everybody can do it overnight like I did. I had been 8 years of playing with it before I even directly stepped in. But my goal is to empower patients going forward with all the practices that I have to help them to understand how a plant-based lifestyle can help them, even if it's only a little increase at a time until they can get there.
Dr. Smith, I want to start with you and then go to Dr. Michaels and Dr. Runny on this next question, because I think it's an important thing. Dr. Michaels mentioned earlier about him dealing with a patient via telehealth. I think one of the things that we've seen for the past year and a half, I know my family has benefited from it as well. My mom is 74. My dad is in his 60s. And so One of the things that they were doing was limiting the amount of time they've been going out. So telehealth was one of the options they took. Have you noticed that people are more concerned now, Dr. Smith, about their health and looking for those avenues like telehealth to be in communication with their doctor or finding a doctor?
Absolutely. I think most people are concerned about their health. That has been put out there, that health needs to be a major concern. Some are more likely to lead down a road of trying to get help without any changes. What I'd like to encourage is that people do like Dr. Michaels has already said, and that we all believe in: empower yourself with knowledge. Get to understand your unique health, your unique challenges, and then do the things necessary to improve your health. If COVID-19 has taught us nothing else, we all need to improve our health so that we can then go out there and face the world with no fear. That is the main thing that we need to do.
Very important. Dr. Michaels, have you noticed that the amount of patients for telehealth has increased in this past year and a half since we've been dealing with the pandemic?
Mm-hmm.
Well, I can't answer that question directly because I've only become involved with telehealth over the course of the last several months. Last year, there were a few patients that we saw with telehealth in 2020 in the clinic that I was working in at that time. Basically just because we couldn't allow them to come into the office in 2020. There was so much fear and misunderstanding about the disease. We understand better now the process that you can take to actually come into the office safely. So to me, what I see with telehealth is less a matter of fear and anxiety about COVID-19 and more a matter of convenience. For a lot of people, it's just simply extremely inconvenient to make the appointment, wait for that appointment to come along, spend the time traveling to there, waiting in the doctor's office, waiting for the doctor, having the whole process occur, and then leaving when it's really a relatively minor problem. Now, of course, if you need a blood draw or you need a physical exam, you have to go to the doctor. But for routine things that come up during the course of the year, like a sinus infection or some complaint that you just need some advice about, telehealth is a perfect platform for that. I think it works fantastic in that regard. But for the most part, as we've been discussing, the key here is to not rely on any one of these platforms, but to really rely on yourself and learning every day about your problem. So one of the key ways that Panoxol was formulated was for the control of blood pressure. And what we want you to understand is that this is not where we want you to say, okay, take Panoxol for your blood pressure and that's it. Just take Panoxol and you'll be fine. No, get a blood pressure cuff, take your blood pressure, know what it is. Because right now, without a doubt, out there today, I don't know how many people are watching this program, but a significant percentage of the people who are out there, whether they're watching the program or not, have high blood pressure and they have no idea. There are no symptoms, there are no signs. Your blood pressure is just high, and while it's high, it's doing damage to the blood vessels in your brain, your kidneys, your heart. That's the key. And I see people regularly who are in their 40s who had no idea they had high blood pressure, who are suddenly in rehabilitation because of kidney failure. And this is just out of the blue. You thought you're fine, then you feel poorly, and the doctor tells you, oh, your kidneys aren't working anymore. You need to go on dialysis. And that's all because of high blood pressure. So please check your blood pressure, understand it. Panoxol can be a great tool to help keep it under control, but that's not the point. We want you to get it under control, whether you need a pharmaceutical or not. Just get it under control. Know it, understand it, and control it.
Right. We're going to keep going around. Dr. Ronnie, I'm going to bring you in. I want to say, because we're getting quite a bit coming in on Instagram as well as on Amazon. I want to reset for those who are just coming in. You're watching Cyrus Webb Presents on the various platforms. I'm your host, Cyrus Webb. We're joined by a great panel of doctors today for not only sharing their expertise, but also their knowledge and benefits of Panoxol. That's what we're talking about here. Today, you just heard there from Dr. Matthew Michaels. We also have with us Dr. Roxanne Smith and Dr. Ronnie. Each one of them have been talking about what they've been able to learn about Panoxol. And I appreciate you all bringing in the questions too. Earl Hall on the Facebook side, we appreciate you watching. Earl says, great info on all of this. We're having some more comments coming in on the Amazon Live side. I appreciate that. Want to bring those in too. Dr. Michaels, a question for you, and then we're going to bring Ronnie. The question is, I haven't been vaccinated. Will Panoxol help the immune system?
Well, this is obviously a very controversial issue. I personally believe that vaccinations are safer than not getting them just because the disease is so virulent. But the fact is that we know now that COVID-19 is not an upper respiratory disease. It's not something that's strictly attacking your nose or your throat or your lungs. It attacks the blood vessels, the vasculature. And we know that every single underlying condition that leads to greater risk for catching the virus and actually having a severe experience with it is something that relates to destruction or damage to your blood vessels. So diabetes, high blood pressure, obesity are the cardinal three. Those three lead to damage of your endothelium or the lining of your blood vessels. The ingredients in Panoxol absolutely have been shown individually as individual ingredients to help prevent that damage. Horse chestnut promotes nitric oxide, dilates your blood vessels so there's less hammer effect of the hard blood pressure pushing against your veins and your arteries. And then it also allows the blood vessels to flow out more rapidly so that horse chestnut actually tightens your veins. So it allows the blood flow out of your ankles, out of your legs, preventing that swelling and that discoloration of your legs. Every one of these ingredients should be parsed individually because they all have a similar effect on nitric oxide promoting effects, but also each one of them has their own individual properties as well that help promote vascular health. And so, yes, I take Panoxol every day with the thought of, I staff nursing homes on a daily basis. I'm constantly surrounded by the risk for COVID-19, just like Dr. Smith is. It's not a happy situation, and I feel comfortable with the fact that Panoxol lowers my risk. I personally have been vaccinated, and that was my personal decision. But Panoxol, I think, is an important part of trying to keep your endothelium healthy.
Appreciate that, Dr. Michaels. Dr. Smith, one of the commenters on Amazon's Up Live says, thank you for the information and all the amazing work you're doing. So all of you are getting some love on the Amazon Live side. We appreciate that. You guys keep that coming. Dr. Ronnie, I want to ask you, because again, and you gave some great examples at the beginning of this conversation today about your patients, but what has it been like for you to see how patients are not only understanding the importance of checking in with a medical professional, but also making sure that they're doing that as they're making decisions as well?
Well, as you know, working on Martha's Vineyard Island is challenging in itself because I get people from all over the country here, and I also get people from out of the country. And one of the things that I have to be able to do is go from chronic illness all the way to someone who don't have a chronic illness, like for someone who's trying to get endurance because they're on a program for sports training, and they need to make sure that they've got good recovery. They need to understand that they're going to have enough energy to do the sports. And so they're trying to build up their nutrition because I do medical nutrition. And then I have people who basically say, okay, I'm not able to focus. Those are my politicians who's been beat up. Cortisol levels are really high. They have so much stress, but they're in denial. And these are people that want the oxygen to their brain. They want a better focus. So I use it for that. So there's so many different ways that you can use Panoxol. We're not limited. And of course, all of you guys out there who are asking questions about the immune system, you understand that Panoxol is for your immune system, because we're talking about all the time bringing blood flow and good circulation, but you also have another job, and that job is you got to make sure you have good nutrition. You got to make sure you do the right thing. Just like Dr. Michael said, it's just not one thing. It's whole body medicine. Mental, physical, and emotional. And that's where your good immunity comes from. So you can't miss any of those things, especially today. But I can tell you one thing, Panoxol surely gives you a good start, but it's a start.
Oh, yeah.
I want to address one of the comments that is on Amazon Live side about Panoxol Plus here on Amazon to help out. So for those who are saying you're having problems actually getting to it, if you click on below where you'll see the Panoxol Plus product there, because I just did it on my phone, you'll see where it says see all buying options when you click there. When you click on that, then you'll see where you'll be able to make the purchase there. You can add it to your cart to be able to get it from there. So I want to make sure, in case for those who are, because I see people are posting, it looks like it was sold out. But actually, if you do click on the product that you guys see there on Amazon, you'll notice where it says see all buying options. Click on that, and then you'll see where you can actually be able to purchase it there. This brings up, hello to you, Felicia. Appreciate you joining us on the Instagram side there. This brings up another question, Dr. Ronnie, since we have you right there, because you brought up something, and this has also been asked about this, and it's something I see that is on the product page, but because they may not have seen it, and you brought it up, I'm going to address the question to you. You mentioned that some patients are taking a certain amount of Panoxol. So I want to ask about that because, with anything that we take, of course, people, they're always want to know how many am I taking, how much am I taking, how many times am I taking it. Talk to us about that and what you found about the breakdown for that.
Well, you'll find that, if you're starting with children, you're going to say 2 capsules a day, like my
Okay.
15-year-old who gradually went up to 4 a day. And we're talking about natural supplements. So we're not talking about something that we're seriously looking at side effects. So you have to be careful with that. You don't want to be afraid of the natural supplements. So, and the reason why I said I'm happy I'm at 4 is because I feel better at taking 4, but no other reason than that. I felt like my energy was better. I felt like my focus was better. So
Yeah.
that answers the question, because it does have on the bottle, you could start with 2.
Got you. Dr. Michaels, I want to bring you back because we're having a question that came in on the Instagram side, and I appreciate you all being with us there on Instagram. Now, if you guys want to actually see the panel, not just look at me, you all can go to the link that is also with this particular conversation there on Amazon Live at CyrusWebb Show.live. You all can go there and actually see the great panel that we're speaking with. But Dr. Michaels, a great question here. And again, it goes to something we were talking about earlier. What are the product health benefits that you normally recommend to your clients when it comes to Panoxol?
So largely what we've been discussing, I think the notion that doing things that can help prevent the age-related changes that lead to high blood pressure in the first place, the promotion of nitric oxide, the promotion of smooth blood flow. Because as we age and our arteries begin to become a little bit less pliable, there begins to become this kind of a water hammer effect where when your heart pumps, the blood flows out, it hits against the tightening, narrowing walls of aging blood vessels. I believe that this product can potentially help prevent that from happening or slow it down, because of course nothing can prevent it. We're all going to age regardless, but we want to age gracefully and slow it down. For me, I also personally feel like it makes a very big difference in my workouts. I've been an exercise junkie 4 or 5 days a week for my entire life. Competitive triathlete before the bone marrow transplant. After that, just a participatory triathlete, not really competing, but just trying to finish the event. But I work out regularly. And what I had found was, I've been taking Panoxol for about 10 months now. I didn't really start off with this idea in mind, although I'd read a lot about nitric oxide and its impact on exercise and recovery. But I began to notice that when I forgot my Panoxol before a workout, it wasn't quite as good a workout. When I didn't take Panoxol after the workout, I noticed that I didn't recover quite as quickly. So I became really focused on making darn sure that I take that protein drink with Panoxol in it before the workout, and that I start the process of getting it ready for after the workout. Before I finish it, I can get it in myself right away. So I talk to people, athletes in particular, about how they can use this nitric oxide, it's all natural nitric oxide booster, to promote a better workout and a better recovery. That to me is really one of the key parts of what this product can do.
Willis, appreciate you. Willis Victory is on the Amazon Live side. He also is addressing some of the comments there. Willis, appreciate you being over there. I have another question here on Instagram, and this is for you, actually, Dr. Smith. I'm glad that there's something for everybody here. It makes it a lot more fascinating conversation. Dr. Smith, you talked about when it came to health and also what you were eating. That's one thing we have not talked about in this conversation that I think is important for us to address, because yes, the supplements can help, but doctor, what do you tell people about the importance of the other things they're putting in their system when it comes to the food, not just the supplements?
Well, what I try to do is make sure that I tell people the truth at all times. And it has been scientifically proven that the vegan or plant-based diet is the healthiest diet for the human body. It has been proven years before I came into medicine. The China papers showed that. There's an increase in the activities of people as they get older. They're able to maintain. There's less heart disease, less diabetes, and things like that. All the things that kill people currently. So I tell them this, knowing that everyone has a choice to do what they need to do. The thing is to empower you with knowledge. The choices are yours. And so I lead people to the path that I have found, but I understand and unconditionally welcome them back whenever they come, regardless of what their choices are, because my role here is to be a guide as you choose the things that make sense in your life. And over time, I hope, like me, you will join me on the vegan side. But that being said, I also wanted to point out that there was a question that went a few earlier about vaccination, being unvaccinated. I just wanted to put out there that I am an unvaccinated physician working with COVID patients. And I wanted to put that out there to let people understand that we all are individual. We all make choices based on our health, based on what we think we need to do, and we need to empower people to continue to do so. So if you choose to be unvaccinated or you choose to be vaccinated, just recognize that the choice is yours. You can use whatever information you garner to make that decision to move forward. But at base, all of us should be eating the healthiest diet we can afford, and also moving our bodies, sleeping well, doing mind, body, spirit, where we're taking care of what we think, because how you think can take you down a totally different road. So we need to make sure mind, body, spirit, all three are being worked on together to go for optimal health.
Appreciate that, Dr. Smith. Dr. Michaels, I want to bring you back here for this next comment, and also then bring in Dr. Ronnie too, and then we'll go back around. And this is Amazon customer. First of all, thank you for following us there on the Amazon Live side. Appreciate you. This is coming from an Amazon customer. How long should I take Panoxol? Is this something that should be part of a daily routine, or is it something that should be taken as needed? Can you kind of answer that for us, Dr. Michaels?
Sure. To me, you should take it as long as you feel like the ingredients in it are useful to your health. And as far as I'm concerned, that's forever. Now, the idea there is this is why we have a subscription program, like pretty much all supplements. But we really believe that just recognizing that there's never going to come a time where you don't want these ingredients in your system. That's not going to happen. I don't think there's ever going to come a time when you feel like you're so healthy that you don't need these anymore. So again, it sounds like a self-serving answer, but it's just the truth. I just don't see a time when I'm going to feel like, oh, I don't need this stuff anymore. It's not going to benefit me. So yeah, I would encourage you to take it forever. You might say, okay, now that I've lost the weight, I'm down to a normal body weight. I'm eating vegan or nearly vegan. I'm getting most of my nutrition from plants. Again, that's the way I would encourage you to think of it. I'm exercising regularly. I'm not being passive about my health. I'm actively engaged, controlling my stress, meditating. And these things matter too. Let's not forget that. That's a very important part of the equation. The stress control and meditation are not trivial parts of this equation. But even when you're doing all those things, I think the Panoxol is just even more powerful. It's not something you can say, oh, I'm doing all this other stuff, I can quit taking it. So that would be my answer.
Dr. Ronnie, I want to ask you this question too, and feel free if you'd like to comment on that one too. But the question is, my grandmother takes high blood pressure medicine, but complains that her blood pressure is still high. Can she take Panoxol to help with that?
So I'll answer that. That's a quick yes. And also she should be taking some garlic capsules. There's a lot of things she can do for that. That's natural. And I would love to, add more to the nutrition part. And one of the things is you may know I do medical nutrition, and basically I can take 21 different chronic illnesses and teach someone a specific nutritional program for their chronic illness. That being said, every one of them can be different. Like I may have someone with seizures, that I may put on a ketosis program. I may have someone who's completely plant-based. So with medical nutrition, there's all types of nutrition. But one of the things that's important, and I'll even talk about myself, I found myself up to taking about 9 to 12 different supplements because, you've heard this before. We all heard that we live in the land of the plenty, but we're starving. We can't eat that much to get all the nutrition that we need. And that's unfortunate. And I don't care how good you eat. You could pay $100 for a meal at the most prestigious, best, healthy, holistic, organic restaurant and still not get the nutrients that you need. Right. So that being said, we do functional blood work as well to try to figure out what someone needs in terms of their holistic medical nutritional program. So Panoxol is just an added supplement. And how long someone should be on that? I plan on staying on it for life. I've never felt this good in a very long time. And I'm talking about years. So, but I'm not going to say that that's all we should be doing. That's part of the solution. That's part of the problem. And that's starting with whole body medicine here.
Well said.
Dr. Michaels, one of the things said, and then Dr. Smith, I'm going to go to you on this too, and then Dr. Ronnie. One of the things that you all said last week that got quite a bit of attention, I have to say I was a little surprised by it. And not that it was anything negative, but it was just a comment, and that was about the claims. You all were all very careful about the claims for Panoxol. Why is it important for our audience to realize exactly, even though you all are talking about the benefits, what you all have to be able to say when it comes to the claims about what it can do for them?
Well, these things relate specifically to regulations and of what we are and are not allowed to say about a supplement. The fact is that unless we have spent millions of dollars on a prospective, randomized, placebo-controlled study and demonstrated over time that this product does exactly these things medically, we cannot make those claims. And it's the same thing that you'll see on any pharmaceutical commercial. Oftentimes, even some of the most advanced pharmaceuticals, they just don't have enough evidence to say this will do this or it will do that. They say it may do this or it may do that. We're in the same place, and it really is just the truth. Without that very high level of proof, you can't say that. Now, we know that each one of these ingredients has been used for a very long time throughout various cultures for these various health benefits. And so we can talk about the ingredients. We can parse those out for you in terms of how beneficial they are to you. We can tell the story at some point about how Panoxol was developed in the first place by a medical doctor for one of his patients who just wasn't getting better with allopathic remedies. And so they decided to turn eastward and look at herbs and other ingredients. And then over the course of a year or more, put together various trials for this one person until they found this specific combination that made a massive difference and really got the patient turned around. That's really where it comes from, is regulations and the truth. We don't have proof that it does this or does that. We can talk about experience, what it does for us and our patients, and what the ingredients do, and that's about it.
Dr. Ronnie, I was going to have you comment on that, but another question just came in, and because of time, I want to make sure I get this in. Thank you, Butterfly Thoughts LLC on Instagram. Butterfly Thoughts LLC on Instagram, Dr. Ronnie wants to know, are there any side effects of Panoxol that the public should be aware of that you normally share?
For the time that I've seen this, I've seen no side effects. And I don't know about Dr. Michaels, but I have not seen any side effects. These are all natural supplements. But of course, like he was saying, we can't make claims. And of course, there could be rare instances where someone may be sensitive or allergic to any one of the ingredients.
Thank you. Dr. Smith, you want to add anything to that?
Well, I was just going to say, just in case you're on other medications for, say, blood thinning or cholesterol or things along that line, because this medication can assist with those things, you want to make sure that you're getting more frequent checks at your doctor if you're going to use them together. And I wouldn't call it a side effect. I would call it a side benefit, because it's helping you to thin your blood a bit more if you need a blood thinner, or it's helping you to lower your cholesterol if you have high cholesterol and you're on medication. Other than that, I can't recall too many, but you cannot be one blanket for all patients. So if you're a person with a lot of allergies, please check in with your doctor. Be careful how you start, and just pay attention to your body just in case you develop some kind of side effect. If not, I think it's a very safe supplement.
Dr. Michael, I'm going to bring you in here for that, but also there's another question directed toward you. And Earl just said he just bought the product, excited to try it. Thanks for the in-depth information about it. So appreciate that, Earl, on the Amazon Live side. So Dr. Michaels, I want to ask you about that when it comes to the side effect. That's a great question. So Butterfly Thoughts LLC on Instagram, I appreciate you for sharing that. Is that something that you have had asked of you, Dr. Michaels, as well?
Sure, absolutely. I think we all have had that question asked, but my experience is that two very specific things to be concerned about. If you're on a specific blood thinner like warfarin, Eliquis, or one of those, the ginkgo theoretically might cause more blood thinning that could cause a problem. So the bottom line there is if you're on one of those drugs, talk to your doctor. Make sure they're aware that you want to take this product. Walk through the decision with them and make sure they're on board with you when you make that decision. When it comes to the red yeast rice is the original source of statin drugs. That's where they came from in the first place. So if you're taking a statin drug, there are very specific side effects that come along with statin drugs. Specifically, rhabdomyolysis, or a very specific muscle problem, can occur when you're taking statin drugs. It's not very common, but it can happen. There is the potential for the red yeast rice and the monocolin D in there, which is an analog of lovastatin, to interact and boost that effect and cause more of a problem. So be aware of that. And again, talk to your doctor before you take any supplement. And Panoxol is not an exception to that.
I appreciate that. A lot of great feedback, and we're so glad to have the various platforms on with us. I'm going to stay with you, though, Dr. Michael. So there's a question that was directed toward you. Make sure that we get that in. They wanted to know, what did Dr. Michaels do to reverse his brain autoimmune disease in practice?
Okay, that was not a naturopathic remedy. That was pretty extreme. I was very, very sick. I had extensive chemotherapy. I've had close to 50 grams of Cytoxan in my life. That's half the lethal dose. I had an autologous bone marrow transplant in 2002. That was 9 grams total body radiation and another 10 grams of Cytoxan. That they very nearly killed me before I recovered. But so the idea there is let's not get into the bad part of it. Let's say, okay, I found a path. I recovered from a very severe illness that is, to this date, really still not well described. In fact, the folks at Fred Hutch Cancer Research Center said they couldn't really put a name on it. But nonetheless, the treatment worked. I went from being brutally ill, having 10 seizures or more a day, to doing a duathlon in 2004, 2 years after the transplant. So to me, the key there was never give up. Right. Recognize that whatever's going on, figure it out. Ask questions. Go to different sources. Until you're 6 feet under, there's always a possibility that you're going to find a better way to get better. We personally have a guy associated with us who has stage 4 lung cancer, who has found a way to survive through the years and be functional and do great and experience a better life despite that, and live with cancer as a chronic disease rather than as a fatal disease. So for me, the path was the moment I got home from the transplant. At first, afterwards, I couldn't walk half a mile without help, without two people clinging and hanging on their shoulders, basically. But when I got home, I just started walking. And after I'd been walking for a couple of miles a day, I started doing what's called a fartelegging, which is a Norwegian term for run walk, basically counting steps. Walking 50 steps, trotting 10 steps, and then trotting 15 and 20 and 30 and 40 until I built up to the point where I could run a mile and then 2 miles and 3 miles, recognizing that I could never give up. I couldn't give up on my brain either. I knew that I could not live on disability for the rest of my life, and I had to go back to work. So a lot of the message in my mind there, from my experience, is be involved in your own healthcare. Don't take anything for granted. Ask questions, look for other solutions, but keep exercising, keep your brain engaged, your spirit engaged, your body engaged, because that's what being alive means. When you surrender and you give up, the depression, the apathy is brutal. So don't let that happen. I'd be happy to talk about that more, but I think this is probably not the right venue. That could be a whole show in and of itself.
Well, again, great conversation. I love the fact that we were able to get so much of this, and I want to thank all of you for being so engaging. Of course, we have a great panel of doctors here, Dr. Michaels, Dr. Smith, and Dr. Ronnie, but I appreciate all of the comments on the various platforms. I appreciate you all being a part of this. I could tell I was not expecting the feedback after the fact, doctors, but I'm so glad that we really were able to have you. One of the comments just came in from Lizelle. Appreciate you on the Amazon Live site. So this is really good information. I'll inform my sister. She's currently recovering from a stroke. Doctors say it was caused from high blood pressure. She would prefer natural supplements. And I think that's the thing, to be able to share the information. I think that is the big thing here. And we're so glad to have a great panel of doctors to be able to do that. Again, everyone, Dr. Matthew Michaels has been our guest, Dr. Roxanne Smith and Dr. Ronnie back with us. Talk with us not only about the work they've been able to do with their patients, but also the supplement Panoxol Plus that's sold here on Amazon. And I want to remind you guys again how to be able to get to it. For those who may have some problems. Earl found it, but if you'll click below, if you're on the Amazon Live side, if you'll click below, if you're on your desktop or laptop, if you're on your mobile device, you'll see it on the side. You'll see the Panoxol Plus product there. Click on it, and you'll notice it says there, see all buying options. Click on that, and that's where you will be able to see the product, to be able to add it to your cart, to be able to purchase yours there. So again, some great information about Panoxol. If you all came in late, you missed part of the broadcast, don't worry. We will be able to have the replay up on all the platforms for you all. So I want to go back around. Bill says thanks to all of you as well. Bill, appreciate you for being with us. Dr. Michael, since we have you up front there, why don't you let our viewers know how to stay connected with you?
Well, you can find me on my website, which is Eliminate Pain from Your Life. That's a website which is a little rudimentary. I haven't really built it out thoroughly yet, but you can see some videos of me talking about my back pain treatment system to get a better idea of what it really is all about. You can find me on LinkedIn, most assuredly. I'm not on Facebook at this point. But the website, again, is called Eliminate Pain from Your Life. And see the videos that talk about back pain. You can also find my book on Amazon. And I really believe that this book can change lives. Again, it's not about shots or pills or any specific therapy. It's about understanding the problem.
Dr. Michaels, I want to make sure, because we want to make sure we tag you. Is it just under Dr. Matthew Michaels there on LinkedIn?
Yes. Yes.
Okay, great. Dr. Smith, how can they stay connected with you?
Well, I have a LinkedIn. It's Dr. Roxanne Smith White. It's on, I'll give you the link. And also, I am pretty committed to clinical and herbal and plant-based sciences. So that's where I'll be doing most of my work. I'm especially excited about all the research that we're going to be doing on all the different things to prove what these products can do. So that's where I'll be.
Okay. All right. Thank you so much for that, Dr. Smith. And Dr. Ronnie, how can they stay connected with you?
So it's you just remember my name, drronniedeluz.com. You can usually find me there. Like Roxanne, I'm also with Clinical and Herbals. Also, we're going to be promoting retreats around the globe, and that will be coming up pretty soon. We do retreats on Martha's Vineyard in the season, and we'll be other places around the country. That website should be up in about a month, maybe 2 weeks.
Okay.
Sounds fantastic, Dr. Ronnie.
So again, thanks to the three of you for being on with us. Some great information. You all make my job a whole lot easier because you all are the experts. You all have the information. I'm glad to be able to share it with our audience here. Again, everyone, Dr. Ronnie, Dr. Michaels, Dr. Smith, great guests talking with us about the benefits of Panoxol. If you all have any additional questions, we will be having them back on the program again. Feel free to keep those comments coming in. We're getting a lot of comments on Instagram saying great information. Thank you. And we appreciate you all watching us there on Instagram. Thanks to all of you for tuning in on Facebook, on LinkedIn, as well as on YouTube. I'll make sure that we tag all of the doctors on LinkedIn as well with the replay video that is up there. For those joining us on Amazon Live, we appreciate you. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, and enjoy your world. We'll be back with you real soon. Take care.
Thank you, Cyrus.
Thank you. Thank you.
Thank you.
Thank you.